My name is Catherine Vanderboom. I'm a clinical nurse researcher at the Mayo Clinic Department of Nursing in the Division of Nursing Research. I've been a nurse for many years. My clinical experience has been working in community health nursing. I've worked in public health and community health, and I've also worked as a nurse care coordinator. And in addition to that, I taught undergraduate students about nurse care coordination, which is part of the research that I'm involved in these days. So I started with a bachelor's degree of nursing, and I followed that with a master's degree. And then about 8 years ago, I obtained a PhD in nursing. The research that I do now is focused on community-based care, of course, for older adults. I have the privilege of working with the ambulatory care practice. So there are nurses who work in primary care, and they provide care as nurse care coordinators. So that fits very well with my clinical experience and with my research interest. So we work within the healthcare home. The nurses are learning a new role, so I work with them in terms of helping to develop the curriculum and then also in doing research associated with outcomes related to that role of care coordination. One of the studies that I was involved with involved a community care team intervention, and we involved nurse care coordinators from the healthcare home in that study. And as part of that study, they learned a little bit about holistic practice using a approach that we called wraparound and a strengths-based approach. So they were involved, the nurse care coordinators were involved in the study for about a year, and then they went back to their usual roles, and they really just talked repeatedly about how involvement in that study informed and improved their practice as nurse care coordinators. And recently, when I was talking to some of the administrators from the healthcare home, and we were talking about what these nurses did, and they said, boy, you know, just involvement in that study really so impacted their practice that they're really considered the rock stars of care coordination. So I think in terms of what we're able to bring in terms of the research that's been done already in care coordination, we bring that those best practices to the current clinical practice, and we use that as part of the studies that we've developed. And so I think involving nurses in those best practices really improves the clinical care that they provide. Well, the clinical work that I've done for most of my career has been involving with older adults, and as I work with them now, you know, more and more of them have multiple chronic conditions which are really difficult to deal with, difficult for nurses to know how to take care of them. So the research that I'm involved in really supports both patients who have lots of things to manage. You know, we're trying to get them to manage more and more on their own. And it's really a new and evolving role for the nurses. So my passion is helping both nurses understand and extend their role, and then because it has such a positive impact on patients.